Have you taken your child to multiple orthodontists trying to figure out what you need to do for your child for that perfect smile? Time for some PFOing so you know where you're going. Hey everybody, welcome back to today's episode, inspired by a Facebook group discussion regarding early orthodontic treatment. Usually that means treatment for kids, maybe your kid, that age anywhere from 6, 7 to 10, 11, depending on if you're a boy or girl. Anyways, okay, the discussion was about early treatment. This particular mom had taken her child to see 2 different orthodontists, and as you might expect, she got 2 different opinions. So today I wanted to just briefly shed some light or give my opinion about the different aspects of her experience, including first 2 different opinions from 2 different orthodontists. Then we're going to talk about the different options, the 2 different options related to the early treatment recommended. So first, child is 8, gonna be 9 maybe, or about 9 years old, which is not a bad time to be evaluated by the orthodontist. Sometimes you can be evaluated a little sooner, especially if you're walking around, child's walking around with an underbite, a big one. You might want to get that looked at just to make sure it's not a true underbite. That's something that maybe, by the time we're 7, we want to have that looked at, but somewhere between 8 and 10 is not a bad time to be evaluated for other early treatment considerations, because there are permanent teeth that are finally coming into the mouth, and we're going through a small transition of baby teeth to permanent teeth. And so we get to see, orthodontists get to see if there are any deviations from normal development. Okay, so let's go back to the 2 opinions. Many of you out there are probably like, surprised by going to 2 different people and getting 2 different opinions. And you're like, well, isn't it like the same thing? My kid's mouth, it's the same. How come, people are seeing it differently, or how come they're suggesting treatment that is different? And the reality is that every professional is different. We all go to school, orthodontic, we go through a residency program to receive our training, and we're trained by professors and excellent professionals in the orthodontic field, but they're all different, and they've all practiced on different people and applied different techniques. So there are some general guidelines that help us as professionals know how to treat patients, but in the end, you may find that if you go to different orthodontists, you will get different opinions. And so one important take home from today is that you need to be ready. That is normal. If you're going to go to different folks, it's normal to get different opinions, and that's okay. What you need to do is you need to ask questions, why they recommend certain things, what are they accomplishing by recommending those certain things, what are the goals, and then maybe do a little bit of your own research. Sometimes you can look online. You got to be careful, because you get these crazy YouTubers out there that are trying to enlighten the world, but they may have some nefarious intentions. Don't worry, that's not me.
Pinky promise.
Okay, so get multiple opinions. That's okay. Make sure you ask lots of questions, specifically questions related to why are we doing this? What are we trying to accomplish? And then, depending on what you learn and how comfortable you feel with that provider and trying to accomplish those particular goals, then you should feel pretty safe about doing or accomplishing things the way that that particular orthodontic provider is discussing. Okay, so that was the first thing I wanted to talk about, because you know what? There are lots of orthodontists, depending on your area. In McKinney and Anna, Texas, there are more and more orthodontists out there, and so you can get more and more opinions about what to do for your child. And you just need to feel comfortable about what's being proposed as treatment, the treatment options for your child. So just because one person says one thing and one orthodontist says another doesn't mean that they're wrong. It just means that they have different approaches for a particular problem. Next, let's talk about the treatment recommended. So this mother brought up that, you know what? They both talked about expanders. I've made videos about expanders. We use expanders in our office, and one of the comments was, it seems like every orthodontist, throwing in expanders in every kid that they can see. In my opinion, and in some of the contemporary literature, orthodontic literature, expansion is definitely a common and useful technique to help address specific problems. And so expanders aren't going away. That being said, does every single kid need an expander? Probably not. So the question becomes well, does my kid need it, or who needs an expander? When you go in for an evaluation and your orthodontist recommends an expander, you can ask, what for? What is the expander for? And they might give you reasons, which I personally think are good, such as to fix a crossbite in the back, especially if when you bite down, the crossbite is forcing your kid, to go go to the side. Crossbite with the shift of your lower jaw, that is a pretty good reason to use an expander. Another reason to use an expander is maybe to create some space. Space creation specifically to address adult canines that maybe are getting a little out of control in their development. Expanders can be helpful there. There may be other reasons why an individual, an orthodontist, might recommend an expander, maybe to just make it a broader arch, right? Big smile. Or recently, expanders have been used to try and increase or reduce the resistance to air through the nasal passageway. So depending on what your needs are, right? You can ask these questions, hear what they have to say, and then some of those expander treatment options or reasons to use expanders are good ones. But the idea of every kid gets an expander no matter, essentially what they've got going on in their mouth, probably be careful about that. And the way that you try to avoid that is get multiple opinions and you ask, why are we doing the expansion? Follow-up point, one of the comments this mother made also was, is it absolutely necessary? Early treatment is not absolutely necessary. That's a fact. And the reality is that to try and get straight teeth and a beautiful bite can be accomplished down the road when we are older. There is at least a slight caveat. I think I'm using that word correctly, meaning that there is thought for your consideration. Some thoughts for your consideration. Certain problems, orthodontic problems, crossbites, whether it's in the back or in the front, crossbites that involve your jaws, your bones, those are more predictably and can be managed with lighter pressure and forces when we're younger, right? Now that age range, the younger age range, it's, not like today, depending where you're at on that, you might have some time, but the older we get, if we have those jaw bone discrepancies, to fix those may require heavier forces, right? So maybe you do an expander later, but as far as getting the ideal result that you want, maybe the predictability of that goes down. The amount of pressure that you have to apply to push those bones apart because you're getting more mature, that becomes harder. And so you may be forced into treatment options like taking out teeth, using mini screws, also called temporary acreage devices, and or surgical options to address the issues if you're trying to go for the ideal. So orthodontists have learned certain problems are more predictably managed when we're younger, and so recommending early treatment, although not absolutely necessary because you could try to resolve it later, early treatment may provide sufficient benefits that make it worth it to spend time and money a little early on, in addition to later on when you're trying to address the remaining problems that you didn't tackle in early treatment. In conclusion, we reviewed a few things for those of you parents, kiddos out there who are getting ready to start your orthodontic journey, and you're doing your due diligence, you're talking to a few different professionals, and you just have questions like, how come the professionals are saying different things? 2, expanders, does everybody get them? And 3, early treatment, for example, with expanders, is it absolutely necessary? Hopefully this information has been helpful to you. I want you to know that I feel like there are lots of really great providers out there, orthodontic providers, that are trying their best to get you from, craziness to just voila, a beautiful smile and a great bite. But despite their goodness, there's still going to be differences in treatment suggestions, recommendations, and so it is important that you ask questions and make sure that you feel comfortable with the answers that they're providing about treatment options for you or your child. Expanders are great tools that can do great things. Does everybody need an expander though? No. Only way to figure out for you is, as you discuss with your provider, hey, why are we doing this expander? Let them explain the goals and the purposes of the expander, and then see if you feel comfortable with those recommendations. And finally, early treatment. Is it absolutely necessary? The simple answer is no. There are lots of ways. There are definitely different techniques that you can apply to your kid or yourself later down the road if you decide to wait and not do any early treatment. The goal of each orthodontic provider should be to try and decide whether or not the advantages of addressing a specific problem in early treatment right now outweighs the benefit of just waiting until later and trying to complete everything in one phase. Hopefully, as you visit with your provider, you guys can come to a conclusion that you feel comfortable with, and you can reach that wonderful result of straight teeth and beautiful bite. If you have any questions, come find me. I'd love to talk with you, give you my opinion, maybe expanders, or if early treatment is even that beneficial to you. So if you like this video, give us a thumbs up, consider subscribing to the channel so that I can open your eyes to the wonderful world of straight teeth and beautiful bites. That's all I've got, just a little PF phone, so you know where you're going. Packard out.